supplements are heavily marketed to cancer patients with promises of boosting immunity, fighting tumors, or reducing side effects. But here's what you need to know. Most herbal products have not been proven effective for cancer, and many interact dangerously with chemotherapy and other medications. Some are contaminated or mislabeled. Today, I want to give you the honest truth about herbal medicine and mesothelioma, what the evidence shows, what the risks are, and how to make safe decisions if you do choose to use supplements. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I am not a physician and this is not medical advice. But understanding herbal supplements helps you avoid potentially dangerous interactions as well as wasting money on unproven treatments. Let's start with what herbal medicine can and cannot do. No herbal supplement has been proven to cure cancer or treat mesothelioma effectively. Claims that herbs can shrink tumors, kill cancer cells, or cure cancer are not supported by reliable evidence. The National Cancer Institute and American Cancer Society are clear on this. Herbal treatments are not proven cancer treatments. Now, that doesn't mean that all herbs are useless. Some might help with specific symptoms or side effects, but the evidence is limited and the risks are real. Why are herbal supplements risky for cancer patients? First, drug interactions. Many herbs interact with chemotherapy drugs, immunotherapy, and other medications. These interactions can make your cancer treatment less effective. Some herbs induce liver enzymes that metabolize chemotherapy faster, which reduces its effectiveness, or interactions can make chemotherapy more toxic, increasing the side effects or organ damage. Also, supplements are poorly regulated in the United States. The FDA doesn't require proof of safety or effectiveness before supplements are sold. Testing has repeatedly found that supplements are contaminated with heavy metal, pesticides, or prescription drugs. They're mislabeled with wrong ingredients or wrong doses, or they contain none of the active ingredient that's listed. You just can't trust that what's on the label is what's in the bottle. Now, I'm going to take a break here. I'm going to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. Moving on, it's important to know that some herbs have direct toxic effects, especially when it comes to the liver or kidneys. If you're receiving chemotherapy that already stresses these organs, adding herbal products can cause serious problems. Now, let's discuss some specific herbs that are commonly marketed to cancer patients. St. John's wort is promoted for depression and mood, and there is some evidence supporting those claims for the general public, but it's also a powerful inducer of liver enzymes and it interacts negatively with many drugs, including chemotherapy. It can actually make cancer treatment ineffective. Never use St. John's wort during cancer treatment. Ginkgo biloba is marketed as helping improve memory and circulation, but it has blood thinning effects that can increase your bleeding risk, especially if you're also taking anticoagulants or have low platelet counts from chemotherapy. Ginseng is marketed for energy and immunity. While there is limited evidence that suggests it might help with fatigue, it can also interact with blood thinners and diabetes medications, and the quality varies enormously between products. Turmeric, or also known as curcumin, is heavily marketed for anti-inflammatory and anti-cancer effects, and lab studies have shown that it has anti-cancer properties in test tubes, but these effects have not translated to proven benefits in people. More importantly, turmeric can interact with blood thinners and some chemotherapy drugs, and high doses can cause digestive upset. Green tea extract is marketed as an antioxidant with anti-cancer effects. Again, lab studies do show effects, but human evidence is limited, and we do know that high-dose green tea extract can cause liver damage. Drinking moderate amounts of green tea as a beverage is probably safe, but taking high-dose extracts is questionable at best. Essiac tea is a mixture of herbs promoted as a cancer cure. There is absolutely no evidence that it treats cancer, and it can cause digestive upset. It also might interact with medications. Milk thistle is marketed for liver protection. Some limited evidence suggests it might help with liver damage, but quality evidence is lacking. And again, it can interact with chemotherapy and other drugs. Echinacea is promoted for immune function, but there's no evidence that it helps cancer patients. And it might actually interact with immunotherapy drugs where the goal is to modulate, not boost, immune function. The bottom line is that most herbs marketed to cancer patients have no proven benefit for mesothelioma treatment. Many have concerning interaction risks. For those where there's some evidence for symptom relief, like ginger for nausea, it's generally better to consume them as food rather than as concentrated supplements. What about antioxidant supplements? This is controversial. Some research suggests that high-dose antioxidant supplements might interfere with chemotherapy and radiation, which partially work by creating oxidative damage to cancer cells. If you're taking high doses of antioxidants, you might actually be protecting cancer cells from treatment. Now, this doesn't mean you should avoid getting antioxidants from the foods you eat. Fruits and vegetables are fine, and they're encouraged. What it does mean is that you should avoid taking mega doses of vitamin C, vitamin E, beta carotene, and other antioxidant supplements during active cancer treatment. If you're considering herbal supplements, tell your oncologist about every supplement, vitamin, and herbal product you're taking or considering taking. Don't assume your doctor is going to ask you. You need to volunteer this information. Never start herbal supplements without discussing it with your oncology team first. It's important that you understand that just because something's natural, it doesn't mean that it's safe. Arsenic and hemlock are natural, but they're deadly. Use reputable brands that undergo third-party testing. Look for USP, which stands for United States Pharmacopoeia, or NSF International Certification. They don't guarantee efficacy, but at the least, you know that the product contains what the label claims. The bottom line is that you should be extremely skeptical of cancer cure claims. If an herb could cure cancer, it would be a mainstream cancer treatment, not just sold online or in health food stores. So don't spend significant money on unproven supplements. Cancer patients are vulnerable to exploitation, and the supplement industry is largely unregulated. Are there any supplements that cancer patients should take? Vitamin D. Many cancer patients are deficient, and vitamin D is important for bone health and immune function. Your oncologist may test your levels and recommend supplementation. This is a reasonable, evidence-based recommendation. Vitamin B12 and folate are both important if you're receiving pemetrexed chemotherapy, and these are actually prescribed as part of the chemotherapy protocol to prevent side effects. Calcium. For bone health, if you're on steroids or have other risk factors for osteoporosis, it's probably recommended. But beyond these specific situations, most cancer patients don't need supplements if they're eating reasonably well. A multivitamin at standard doses is probably harmless, but it's not necessary. What if you're using herbal supplements and you don't want to stop? At a minimum, tell your oncologist exactly what you're taking, including the brand name and the dose. Ask specifically about interactions with your cancer treatments and consider stopping supplements at least a week before and during each chemotherapy cycle to minimize interaction risks. Also, accept that your oncologist might strongly recommend stopping supplements if they pose risks. To review, herbal supplements are not proven treatments for mesothelioma. Most lack evidence for cancer treatment, and many interact dangerously with chemotherapy and immunotherapy. Supplements like those are poorly regulated, with contamination and mislabeling common. Specific herbs like St. John's wort can make cancer treatment ineffective, and high-dose antioxidants might interfere with chemotherapy. Always tell your oncologist about all supplements. Never use herbs as an alternative to a proven cancer treatment. Evidence-based supplements that are safe to take include vitamin D, B12, and folate if you're getting pemetrexed treatment, and calcium for bone health. Otherwise, it's a good idea to avoid herbal products during cancer treatment. Visit mesothelioma.net for evidence-based information about mesothelioma treatment. And if you'd like to speak to somebody about assistance and support, call 1-800-692-8608 or use the live chat feature on our website. As for me, remember to post questions below, and I'll see you next time.